Hi everyone, this is Julia Kahudiak for Randy's Assisted Living Manor. This will be the last blog for this part of the series on caregiving. We hopefully have been helping you and providing you with information that you can use in your daily living with your elderly ones. Well, this last one is going to be the most difficult one for most people because it deals with end-of-life issues. In this particular one, we will be discussing the broad choices that they have when they are on the end stages of life, which can be very simple or complex when dealing with life issues. Their choices at this point may have a lot of ramifications and consequences, so it is very important that everything is placed in an orderly manner and discussed with healthcare providers and such. Dying and death are very difficult issues to discuss for the most part, and I'm sure it has caused some anxiety. So please make sure you talk to the appropriate people and get assistance. Around this particular topic, there is a lot of ethical and moral issues, obviously. But I find that truth-telling and effective communication by the healthcare providers is very important. So this is how you will need to approach them in asking them to be very honest with you in terms of their feelings and how this is all going to be conveyed. Another thing with end stages of life, you may want to discuss pain management options. Are there advanced directives that are filled out? And make sure that your doctor or doctors are willing to follow your advanced directives. The law does not actually force the doctors to do so, but this is where your discussion with them concerns the moral and ethical boundaries that they might feel they have on this. Also, make sure that your doctor has a completed directive on this from your loved one. And then they also have the name and telephone number of the appointed healthcare agent in the case that this is required. In terms of talking with the doctors, I think it's very important to be very open and candid with them. This is very important because I feel that if you're feeling or not telling the truth about something, or your heart is not, it makes it very difficult in the end because you may land up in court. Also, please make sure if no advance directives are written at this point in time, make sure that there is one while you are still competent. If you find that you're having issues in dealing with this, there are people in the industry who can help you, and there are specialists from the faith, specialists from the social workers, specialists from the palliative care, and so on. So please make sure that these wishes and information that you have written down are with someone who's able to provide this information when the time comes. So hopefully these 10 blogs that I have provided you has given you some communication information, and we'll move on to the next chapter of series on caregiving. So give us a call at 315-200-0658.